Oh my goodness. Okay. It says there's an issue with LinkedIn. Oh my goodness. Okay. All right. I don't know how to fix this. Okay. That's technology for you. All right. Hello, everybody, and welcome back to The Rich Life. All right. Hello, everyone. This is Richie Holmes Grant. Welcome to my first official live series called Live with Richie. I'm so excited to have all of you here. I know a lot is going on right now in our world, so that's why it means a whole lot to me that you are here. But I promise, as always, to give you the best information. And I want to start this new series with what's top of mind, what's been top of mind for the past 3 months, and add also what's been top of mind over the past week, and talk about COVID-19. Okay, the pandemic that's gripped us for the past 3 months. We know that the end is not really as close as we thought it would be by now. There's still a lot of stuff going on that I want to make sure we are we're very careful about as we move on to this phase of reopening. Okay, so I've brought a special friend of mine. Her name is Dr. Aabha Jain. She's an infectious diseases physician here in the Washington, D.C. area. I actually met her like I meet many of the people who I have on the show just through a random event. We were at a candle making workshop and we sat beside each other and we started talking about what we both did for a living. And I was fascinated because I had never met an infectious diseases physician. I mean, it was like, oh my gosh, I have all these questions for you. And she was so gracious to answer those questions. And we kept in touch. And Dr. Jain, she's watching. I'm going to bring her in a second. I don't think I've ever told you this, but the week after we met, I actually got the flu.
Oh, no.
My daughter picked it up from her school, and we were in fact on our way to get our flu shots when she told me she had a fever. And I was like, wait, what? So, but I felt empowered because I knew the ins and outs of how the flu shots worked. I knew even if I got one that day, it wouldn't immediately kick in, which I didn't know before. So that's why I wanted to bring her on the show today to just again, empower all of us so that as we move into this new phase of reopening, we are not putting ourselves back into harm's way. So without further ado, welcome to the show, Dr. Jain.
Hi, thank you so much for having me on this.
You know what? I'm actually hearing an echo on my end. Do you hear an echo on your end, for instance? Maybe I need to turn my volume down. I'm sorry, guys. Okay. All right. Is that better? Well,
right.
Can you talk and let me see if that's better. Is that better?
Hello.
Okay. I'm not hearing an echo, so hopefully that's okay.
Okay.
So why don't we start? First of all, welcome.
Thank you so much for having me. This is, first time doing this, but I'm so excited to be here.
Yeah. We actually, to our audience, we actually planned to do this right at the beginning of the pandemic. And I reached out and I said, why don't you come on my show? And she said, of course, I'll come on the show. And then I think maybe it was like a weekend passed and she was like, well, I don't think I can make it anymore because now I'm under quarantine.
Yeah, it's been quite a few interesting couple of months, to say the least, not only for myself, but for everyone. And yeah, that's when everything was starting to happen. There's so much information coming day to day, data, we're all learning in this together, me and from the healthcare perspective, everyone in the community. And, as, chance would have it, as we were planning a full discussion on what to do in the initial parts of COVID, I unfortunately did get exposed and was under, home self-quarantine for 2 weeks after my exposure. And, things have rapidly been changing week to week, day to day since then.
Hold on one second. I'm getting a note that from Instagram. Maybe you can turn your volume down. The mic will still pick up your voice. Thank you guys for bearing with us. This is our first time trying this. So I love my audience. So I appreciate you guys for making sure that this works well, because I want to continue this series. Okay, so
is that better, or is it you still hear an echo? No, still hear an echo. Hold on. How about now?
How's that, guys? Someone let us know out there. Okay.
Is that better? No. Oh. It's on mute.
What we may have to do, I hate to do this. I wonder if the issue is that we're on LinkedIn. I mean, I'm sorry, if we're on Instagram and the rest of the main feed on StreamYard. I wonder if that's the problem. Okay. So Antonella says she can hear well on your side, on her side. Okay, so let's proceed. Let's not take up too much time. Again, if you do hear any echoes or if there's any technical difficulty, let us know, and we will do our best to accommodate whatever we can, given the fact that neither one of us is really tech savvy, right?
Going with the flow.
Let's go with the flow. Okay, so you were talking about at the very beginning when you were actually quarantined, and that
Right.
was out of an abundance of caution.
So it was so this is again at the very beginning of knowing what COVID was, and us, learning in the hospital setting how to diagnose and treat and test patients. I, actually saw the very first patient and diagnosed the very first patient in our hospital. And unfortunately, just with the limited testing that we had at the time and, limited information, it wasn't, the patient wasn't tested the way we had hoped the patient would have been tested. And that, led to my exposure, of course, amongst many other healthcare workers, staff, nurses, physicians, and led to us being exposed and having to be under quarantine just for the abundance of caution, just in case if I had developed any symptoms, and to symptom monitor for that time being.
Okay. And so you're obviously now back at work.
Correct. Back at it.
So what's it been like for you over the past 3 months?
So it's been a very, very interesting experience. Just a little bit, for everyone's background, for infectious diseases, I've been practicing now for about 4 years out of training. As an infectious disease doctor, we're seeing in general, my spectrum is any illness, a severe illnesses, fevers, infections, viral illnesses that we see. And I am a consultant at a hospital. So patients that come into a hospital that get admitted, their main doctors, ask for advice from us for consulting as, hey, we think this patient has an infection, they have a fever, how do we manage it treatment-wise, diagnostics. So for COVID, it's a viral infection. This is, right up our alley of virus that what we treat. And it's definitely been a very humbling and eye-opening experience. This is, for many people like myself, first time ever experiencing some pandemic, an illness of this type. And, it's a very much of a time of us learning from one another. It's, we're leaning on one another for everything that we can, helping, guiding patients, colleagues, staff, everyone, you name it. And it's, it's been tough. It's been humbling. It's, it hasn't been easy every day. And, we take it one day at a time, really trying to help out. And, my job is always to be there for the patients and do what I can, the best that I can.
So on behalf of everyone watching, let me just say thank you. I know that this is not an easy thing to do. And while we are all sheltering in place at home, you and your colleagues are on the front line. And that just means so much to me and so many people out there. So thank you. So I want to talk about this before we kind of get into the other things that I had in mind when I first scheduled this interview, not the first one we wanted in early March, but this one. Right now, we're in the middle of a crisis in the US.
Mm-hmm.
We've got protests in so many major cities. We've got people in large groups. What can we say to them, the people who are out there peacefully protesting? What can we say to them to stay safe during this time so that they're not out there putting themselves in harm's way?
It's a great question. I think, this isn't an easy time. We have so much going on in our communities right now. And on top of that, we have a pandemic. And, this isn't, anything safe that we're dealing with as far as COVID goes. And, peaceful protests are, part of society. We do them all the time. The pandemic makes it a little bit trickier. Some of the big things, it's the same things that we've been talking about and discussing in the communities and media as far as what we need to do to be safe. Small, protests are large groups. That's not something that we can prevent. We can't prevent people from gathering peacefully to protest. But what we can try to do is what we've been, encouraging through guidelines right now is, small groups as you can. Keep, if you're going with a group of friends, always go, don't go alone. Go in groups of friends if you are for peaceful protesting. Try to maintain distance from other people the best that you can. Face coverings, masks are very important, especially in the close distances. Eye protection, staying hydrated, are other key factors as far as just really making sure, we're doing what we can to not protect ourselves, but we're also trying to protect everyone else there. That's the key, is what we do is trying to protect other people in the community.
Okay. And that's the part I think that so many people are missing. Even if you are not feeling like you have symptoms, right? We can still be asymptomatic and carry those symptoms or carry COVID-19 back to someone who we may have contact with who's in a vulnerable population, right?
Absolutely. And that's one of the toughest parts for me as a clinician, and how do I explain that to people? Be like, you have a virus and you don't even know. Mm-hmm. And that's a very difficult thing to explain to people, and I wouldn't even know how to explain it. And that's exactly why it's more important to do what we can to protect our community, because that's all we can do at this time as every citizen in this country and the world, is we have to be looking out for each other the best that we can.
Right. Of course. Question about two things. One, distance. I read the other day, and I read probably way too much because
there's not enough to read.
But 6 feet, is that enough? So we've been hearing that for months now, but is that, I've read that it's not enough.
So, I mean, again, there's so much data out there. There's so much media news out there. So 6 feet has been a minimum guidance that the CDC has put out, not only for COVID, but for any viral illness. When flu season comes out, other viral illnesses, from the data and research that they have done for years on end, I think from how we produce droplets, me talking right now, communicating right now, we produce droplets. So what we see is that droplets can go up to a minimum of 6 feet in distance, can go further. That's where it says maybe 6 feet isn't enough. The key factor in this now is, the mask protection. So it's, yes, 6 feet may not be enough, but if we wear a mask and protect our, I'll cover our mouth, we're then trying to prevent and limit the distance that these droplets can go.
Okay. And speaking of masks, you have a demonstration for us, which I can't wait to see, because I don't know if I've been wearing my mask correctly this whole time. I've just been thinking, oh, I have a mask. It should be working, but can you show us that now?
I think so. It goes back to what, the CDC and everyone has recommended right now, is now that our communities are opening up slowly, based on what's happening in communities, based on counties, based on data of trying to flatten the curve, trying to get to the next steps of movement. We can't social distance forever. And that's not the solution, is social distancing forever. And we need to find a safe and a proper approach on how we can do this. So, now that, universal masking, what is that? So let's start with that, because I think that's an important thing. So, we talked about the 6 feet rule, like 6 feet masking, we want to keep safe. We're outside, where people are running, people are walking. If movement's fine, the key issues that we see are, grocery stores are opening up, pharmacies, indoor places where, we can't always keep our distance, and we want to make sure we're keeping each other safe. So the guidelines, say for the community, a cloth mask is appropriate. So I have a cloth mask I'm going to show. So this is a cloth mask. So the best and key important thing is make sure it has good security for over your ears. So hopefully you guys can hear me while I put this on, but we'll try. So covering up over the loops, you want to make sure that it's covered from the bridge down to the chin, secure on both cheeks. You want to be able to make sure that you're breathing comfortably and you're not gasping for breath. You want to make sure you need to be talking, breathing, and feel like you're comfortable. So this is proper mask, over the ears, secure on the cheeks, covering bridge to your nose to bottom, where we can secrete our droplets. So the key, and I think the more important part is we can put it on, and again, the issues that we see about putting it on is people will sort of kind of cover their nose and not really cover it. The nose, we need to make sure we're covered. It's just not up here, it's all over, like cover everything.
Okay.
So we have our mask on. So the key part, I think, and what's more important is taking your mask off, I think is key, because now we have the contamination all in the front of our mask. So anything that we've been, protecting, it's on the front. So what we do is we take it off safely over our ears. We want to make sure that we hold it from the inside, fold it in. So anything that was out in the barrier, the outside, is now inside. And so we're holding it from our place. So, it's our germs inside. And then usually, instead of throwing it in your purses, throwing it in the back pockets, you want to have a protective, like a bag, a brown bag, plastic bag where you can cover and put it in safely to store. So if you're at the grocery store and you now take it off, you have somewhere to put it now. So it's protected, covered, it's in, you seal. And then most importantly, we now hand sanitize. So make sure, now that you've touched everything, now you've cleaned up, have a protective area for your mask.
Okay. I was trying to manage actually putting some banners up so people would remember the important parts. But I want to get back to something that I was wondering from the beginning. So yeah. Cloth masks. So that means, what about those disposable masks? Are they not as effective?
So the disposable masks I think what you're talking about are the surgical masks.
Yeah.
So, those are fine. Those are great. I think, again, it goes back to the healthcare workers in hospital settings where for a lot, people hospitals aren't as fortunate to have enough. So they're trying to keep surgical masks and the respirator masks, like the N95, the very durable respirator masks, still in supply for hospital settings and for healthcare workers. Because, even though, COVID's been happening, not every institution, has been able to have enough PPE, the protection for the healthcare workers. So if you have them, that's great, if you've had a store, but, I think that's why cloth masks have been more vetted by the CDC for the community, just to save what we can for the hospitals in the community, for the hospitals and the healthcare workers.
Okay. I just got another note about the audio. Guys, thank you so much for writing. And I am trying to figure out what's going on my end. I promise next time we won't have this issue, but please bear with us just a little while longer. And hopefully you'll get the information you need, even though there might be an echo on your end. I'm getting mixed signals from different platforms. But let's talk about washing your mask.
Yes.
So how often, if we're using the cloth masks, how often should we be washing them?
So that's a great question, because, again, I think a lot of it is very dependent on how often you're using your mask. If people are still self-isolating and not really going out as often, and maybe one trip to the grocery store every couple of days, I would say wash it routinely, like maybe once every few days, depending on how often you're using it. If you're someone who's out and about every day running errands, maybe more of a daily wash may be necessary. The key thing is again, it depends on how many masks you have, the availability of the cloth masks, because the big thing we need to worry about and make sure is the more we wash these masks, we may be, damaging the structure of the mask. And, at some point, if it's not going to be staying secure where we need it to cover, the utility of the mask is gone. So I know there's a lot of people who, are, anxious and, after every use want to wash it. And, and it depends, like if you've been out and you feel like you've soiled your mask, if you sneezed in it, you coughed in it, obviously, you want to keep it clean. But like a small, use for maybe 1 or 2 hours in a day and not using it for a while, I would say, make sure you wash it every few days, routine laundry wash, but I wouldn't, wash it to a point where you're needing to buy new masks more often than you're using them.
Okay. All right. So I'm just going to see if I can look at some questions. Okay. Let's see here. Oh, I'm hearing great on my iPhone. Thank you for doing this. Thank you for sending this.
Helps us with our technology.
Thank you. I appreciate that. It's different than when I'm actually filming my regular show, because I can go back and look at things and edit. But I love lives too, because that means we can interact with you. Now, we're reopening. Okay.
Yes.
We talked about what to do when you're in large groups, but what do you do when you just want to go to a restaurant? And certainly, I know if you're anything like me, you're tired of cooking every meal. But also, I'm not too anxious to go to a restaurant, because personally, I'm concerned. But for those people who are out there who want to go in, how can they best protect themselves and their families when they're dining out?
So this is a really good question, because, I'm learning a lot as everything's opening up too. I know certain communities, a lot of communities, counties, cities are opening up based on the data that they're getting from like their health departments. The key is, we want to make sure that the numbers are at a safe place, coming down, trending down before any of this is happening. And I know that's been a very controversial topic. That's like a whole other discussion that can be had on how that's happening. But as, we've opened into, these phase ones, green phases, yellow phases, right now, I think, at least from what my knowledge is, indoors is still very risky. And I don't know of many places that have had indoor. Outdoor has been where we've deemed it a little bit safer to start practicing social distance eating out, in small groups. Okay. I think the key is still, small groups, small gatherings, outdoor spaces, and, following and abiding by what the rules that every company, restaurant has. Because, again, we're a community. It's not just me that I need to worry about. It's me, the other guests, the waiters, the servers, everyone at the restaurants, places that we're going, and making sure we're abiding by the rules that, they put in place to keep everyone safe.
What about surfaces? Okay.
Yeah.
That's another one where I feel like I have gotten mixed signals on that. And God bless my mom. I know she's watching. She sends me something and she's on the West Coast. So I get these messages in the middle of the night, very early morning. And so the latest I've heard from the CDC is that you can't actually get it from surfaces, but that hasn't stopped me from quarantining my packages. So what do you know about this?
So it's a lot of what we hear and listen to on the media. And surfaces and packages, I would almost put as two different categories. So surfaces, it's the particles that we worry about. What they're talking about are what we call fomites. And that's like the droplet particles that can land on any of these couches, handles, countertops, kitchen tops. Those are the surfaces that I think we are, that's what we talk about, where, the things that we use more often, like we open our door every day, we open the car door every day, we use the bathroom handle every day, we're using the kitchen counter every day. These are the places where, where if we're in a community, if we're at home, someone sneezes at home, when did we ever think twice about cleaning a surface when we sneeze or cough?
Right.
That's sort of, the more everyday uses of surfaces is where, there's more guidance on making sure we clean more routinely. And routinely is obviously different for every family, depending on it's me living alone and I'm at work all day, and I'll make sure after work I'm, cleaning my light switch handles, my door handles, with a wipe once over, versus, if you have kids running around and touching everything left and right, maybe doing it a couple more times in a day, just depending on how often, things are being touched.
Okay.
When it comes to packages, I think that's a little bit more controversial. And, because packages have been delivered from all over the world all the time. And we've never really had any data or research to say that this virus has been on a package for the last week when it's been traveling from all over the world. To get packages from all over the world when we've had flu season, when we haven't any season of any viral illness that's been around, and we haven't really seen any data that says that this package, you know, is it's contaminated. I mean, I think I would still use precautions of, you know, have your package, open it, wash your hands, you know, same, like hygiene is key for everything, and, you know, go from there.
Okay. So we just got a question from Robin on YouTube. Thank you, Robin. And you're welcome for doing this session. I'm happy to share my contacts, share my knowledge with everyone out there. But what do you see? So let's talk about two things. One, let's talk about schools. I know that's a big deal for people. But in the short term, before we get to schools, let's talk about the summer, because in many places, school has either already ended or is ending really soon. And so now we have kids with really nothing to do. Right. So what are your thoughts about summer recreational activities? So camps or swimming pools, that's a big one. Or any sort of summer sports. The pool, that's a huge one. If you could kind of give us some insight so that we're not putting our children in unnecessary harm's way.
I think this is a great question. This is a question that I've been getting from my own family and close friends and relatives. It's not an easy question to answer because this is an unknown for all of us. I personally, you know, I can't predict what's going to happen, but, you know, life has to move on. We can't keep our kids indoors 24/7, but we want to make sure what we're doing and we're doing safely. So to sort of just break down, you know, all these different recreational activities, and it goes back to the key points of what we've been wanting to do for the whole time for COVID and social distancing. Like one of the key things is that from what we read and what the data shows is that the virus isn't in water. So in the pool itself is not an issue. I think the issue is going to be, how do we social distance at a pool? That's going to be a big concern, is until, you know, when we can say that we're not social distancing, not having large groups, that's going to be the bigger issue. Is if you have like you know, some people, you know, depending on where they live, you know, their homes have, you know, pools in their backyards, that might be, you know, very small gatherings might be something to discuss, you know, 1 or 2 kids, you know, it's still small gatherings outside, how to keep social distancing in that way. Summer camps, I think, is a more difficult one because, you know, how many kids are you going to allow, and how many, you know, kids are the camps going to allow? So a lot's going to be discussions with, you know, the communities and the groups. And, you know, if there's going to be camps that they're going to say, we're only going to take like 6 kids at a time and do only outdoor activities and follow up from there, that's going to be a discussion that, you know, families and parents are going to have with what's opening up and what the rules and regulations are. And I think that is the big key, is one, knowing the county data for where you live and seeing what the numbers are looking like now that summer is happening, seeing what the trends in your numbers are going to happen, make sure that the numbers are staying down. If it's day camps, daycares, community pools, look to see what guidance these areas are giving to you as far as what they have reviewed and what they're showing is safe and how they're managing, you know, kids and the communities. Because, you know, you don't want to go somewhere and not really have, you know, rules and, you know what's safe and what's not safe, and you need guidance on what's going to happen with that. And with parks is the same thing. And I think the important part is, you know, kids are, you know, it's tricky. You can't keep a kid at home all day. It's, you know, I mean, as adults, we can't be at home all day. And I mean, for kids, it's even harder. And, you know, and I think a lot of it is, you know, the education we're giving our kids on what's happening in the community and what's happening in this society, and what, you know, they need to learn, you know, about hand washing, germs moving forward, and how they can keep themselves safe. And also, again, knowing that it's their job as well to keep others safe, and how we can, you know, best teach that to the kids.
Okay. I just was reminded that I did something cool for you guys. My videographer, now turned producer, wanted me to add my logo, my watermark. So thank you for that, Antonella. You guys are our guinea pigs. So thank you for bearing with us. I got a couple of questions on Instagram. One, someone wants to go back to the stylist. And listen, I don't blame her. Okay. Because I did my hair for you guys today, but I miss going to the stylist. So I know
Yeah.
I've gotten some notes about what they're doing. They've taken classes, they're sanitizing everything, they're spacing out their clients, but stylists and makeup artists, I mean, that's very close contact.
Absolutely.
So what can we do to
Again,
stay safe?
yeah, so I mean, this is a great question. I mean, one of my good friends, Laura, is a stylist, and we've been talking about this and how, what is safe, and it's keeping me safe, keeping them safe. What do we do? I think the salons that I'm aware of, at least in my community, have come out with protocols themselves on what they expect from the customers themselves on how to protect everyone and what they're doing to protect themselves. And I think looking at your stylist's salon's policies are going to be key. Keys as far as like obviously it's an indoor area, mask wearing, going from there, temperature checks at most places, making sure you don't have symptoms and fevers. So a lot of the basics that we've been doing for a lot of different areas is still going to be important. And to check in with your salon and your stylist as far as if they have any particular rules and guidance to follow. We can't keep everything shut forever. People, need to move forward as best as we can. And we want to make sure we're doing it cautiously and safely. And again, it's to protect everyone in the community as we do it.
Okay. Now I got another question.
Okay.
The dentist.
Okay.
So, surely we all want our teeth to look nice too.
Yeah, absolutely.
Short of an emergency, is it something that you absolutely, the dentist is really close to you.
Absolutely.
So should you put off your regular cleaning?
I mean, again, I would say that the dentist is at more risk of contracting something from the patient than the patient is from the dentist, because the dentist is doing all that manipulation in their mouth, and it's more the patient that's putting the dentist at risk, and then vice versa. So, again, I think it's going to have to look at how the dentists are opening and what they feel and deem to be safe. Because obviously dental emergencies happen. There's tooth emergencies. We can't shut that down. Like people, it's good. It's hygiene that we need to do. Mm-hmm. And it's going to be that discussion with what the dentists are deeming services that they feel are appropriate at this time. Routine cleanings may, are not as urgent. So they may, they may have policies holding off on certain procedures versus others because, they obviously also, are well-versed and well-studied on what's important and what's not and how to take care of themselves. Because to me, it's the dentists that are being put more at risk because they're doing the manipulations in our mouth, and our, or like our sputum and our droplets are the ones that are exposing them.
Okay. So that was helpful. Someone has a cleaning tomorrow, so this is so great. Okay, I'm glad we could be relevant. So I do want to check in just to talk about. Oh goodness, wait! I just got an alert that. So of course, you guys, I remember to charge my camera to make sure my camera batteries were charged and all of that. But I did get a message that my laptop needs to be plugged in. So I'm going to step away really quickly. But I want to talk about. Symptoms, if there are any new symptoms that we might not have been really aware of from the time we learned about the pandemic until now.
Yeah, so I can start talking about the symptoms. So I'll just, I think just to make sure everyone, has the same basic information, when COVID first emerged, we were discussing it as mainly a viral illness, meaning fevers, cough, shortness of breath were the main ones that we were initially looking at. As data and every information has emerged, we've seen that COVID has caused numerous more symptoms that, things that maybe we weren't really paying attention to or looking out for initially. So one is shortness of breath is the key that we've all been seeing, in fevers. And the best way for me to describe shortness of breath, because that is, even though it sounds like a very simple term, for us, when I say, "Oh, are you short of breath?" It's, not the shortness of breath you get after you're running, or you haven't worked out in a while and you're like, "Man, like I'm really short of breath." you're doing your routine. Like I walk, 2 steps to the bathroom and I feel more winded. And the more I'm doing stuff, it's not getting better, it's getting worse, and it's not going away. And it's that sort of incremental worsening of that shortness of breath.
Okay, that's super helpful, because I know there have been several times when I'm like, do I need to go get tested, or do I just need to get back on the bike?
Yeah, so that I think, and I mean, for any of us, when, we're hearing these symptoms, and it's like, oh, like, am I really that short, like winded, like what's going on? But yeah, it's sort of that gradual progression. It's like, I'm not doing anything and I'm sitting here and something's like, can't catch my breath sort of feeling. So that's one. Fevers are another. A few others that, we've definitely been seeing and that have been reported are, GI symptoms. So that meaning like our nausea, vomiting, diarrhea have been reported as symptoms, which again can be caused by numerous different infections, food poisoning, not eating something right, other viruses. But unfortunately, COVID's, covering the gamut of everything right now. So that's something else to look out for. We've seen skin manifestations. And again, this is something that I personally still haven't seen. So this is still very brand new to me as what we're following with that. Another one that they have reported is anosmia, or the lack of smell, which, we don't really, we can see with a lot of other things, but they have noted from data from other countries that have been coming out to the US that's been something else that they've noted as well, with patients presenting.
And would you say loss of taste as well?
Yeah, so like loss of smell has been key, some with loss of taste, but smell has been the key one that they've noticed.
Okay. And what about pink eye? Have you seen that at all?
No, so pink eye is its own viral infection, but I personally have not seen pink eye associated directly with COVID.
Okay. And this new thing that they're finding with children, the Kawasaki-like disease, what is that? Can you just break that down for us and let us know how is that different from COVID? Is it caused by COVID? Is it a lethal type, fatal thing, or is it just very uncomfortable for the children?
Yeah, so Kawasaki's disease is actually a more well-known illness, or it's an inflammatory syndrome that young children can get, and that's been well studied for decades, and that's something that when I was doing my pediatric rotations in medical school, it's something we studied to learn what those symptoms are, and it's an acute inflammatory response. So it's like rashes, fevers. Kids just don't feel well. What we're now seeing by case reports, which is really fascinating, is young kids are coming in with what they look like an inflammatory response syndrome, very similar to Kawasaki. So, it's all supportive management as far as, we need to make sure the kids are stable and being well taken care of, and symptoms are managed. And, it's what they're trying to determine is it related to COVID, what they're seeing? Is it how closely related? Since how similar these symptoms or the symptoms are to Kawasaki right now. So it's something to, with kids, fevers and illnesses, obviously, a lot of, parents go to the pediatrician, and pediatricians are, keeping an eye to make sure that, if there's any concern for the inflammatory response that they see in Kawasaki's, to be on alert for that.
Okay. I did get a question about age range as far as COVID goes. So are we still at the point where, I know you work with nursing homes, are we still at a point where we're seeing most of the cases and deaths with people who are, I guess, in the 60 plus range, or is it right now just kind of running the gamut as far as ages go?
Yeah, so I mean, I think when first data and information was coming out, it was sort of the, elderly were like where we were targeting, and, the nursing homes were, because that was sort of the petri dish of like where patients were coming from. It's their close quarters. And, we're saying, they're older, they can't hold an immune response as well as, someone younger. Unfortunately, I think now, as we're seeing more cases, and I think in the key is we've been able to test as widely as we can, or we're trying to test as much as we can. We're seeing definitely younger patients, running the gamut, unfortunately from teens to 20s and older, and all on all different spectrums of the diseases, from mild to very ill. And, once as from my side, from the healthcare workers, we start getting more data and research, we'll see why. And unfortunately, we don't really have a clear answer on why, a 20-year-old can be as sick as someone who's like in their 60s.
Okay.
But it is still the gamut of age ranges. It's not like, oh, I'm young, I'm healthy, I'll be fine.
Okay.
That should be something that, should still be taken with a grain of salt. Like, still protect yourself, protect everyone else.
Okay. Thank you. Thank you for saying that. I think that's important for us all to know. I want to take a question that we have on the screen from Robin. Thanks, Robin. What is your recommendation on UV sanitizing wands versus disinfectant wipes for treating groceries? Ooh.
Yeah. So I
okay.
personally have not heard of UV sanitizing wands. I'm not too familiar with, how they work or how effective they are with, cleaning off, the fomites, like the bacteria that we're worried about, the germs, until if we have, or if you can find adequate data saying that this is appropriate, that's one thing. But I think to be on the safe side and making sure we're using our materials wisely and being safe, I would still stick to disinfectant wipes, to clean surfaces. At this time, because I unfortunately don't know too much about what UV sanitizing wands do and what the data is as far as how effective they are in cleaning groceries or surfaces at this time.
I would imagine that's the case with a lot of these things. We just don't have the data. We have questions, we want the answers, but we don't have the data. All right, so let's see. Let's take a question. From Jeanette. I would love to see other families again. Is it safe to meet with one family if we social distance?
So that's a great question. I think, we're all sort of itching to get out there and, start meeting people. I think, if you have to sort of communicate with other families and see what I call is your bubble. Like, if depending on your family, how many are in a family, like that's sort of your protective bubble right now. And the more people you invite in, it's sort of, that's the multitude of, what the risks that we're taking. And, if you've been keeping yourself safe, and your family safe, and now we're like, all right, we're going to social distance, how can we do this safely? And if you communicate and you have a family that you're like, hey, we've been staying amongst ourselves, have you been staying amongst yourselves? Our kids want to hang out, how can we do it safely? And I think it goes back to, I think I would still keep everything outdoors, keep social distancing, depending on what activities and how old the kids are, again, educating the kids to be like, maybe this isn't a safe time to go hug your friend, touch your friend, still play, but kind of keep your distance on what games you can play. If they're old enough to wear masks and can wear masks safely, the kids, should be wearing masks. Keep hand wipes, hand sanitizers there to, just make sure, whatever they're touching, whatever they're doing is safe. And I think a lot's just going to be still, good communication with everyone on how you want to do it the best way.
Okay. So thank you for that. I've got another question here. Let's see. What are the best precautions to take if we go to restaurants? We covered that, right? Did we cover that? Okay. So let's just do another, just brief overview for anyone who missed that.
Yeah. So restaurants, again, as things are opening up, I think the precautions we have to take, again, I don't know of restaurants that are doing indoor seating yet, because indoor seating is, I think, where the precautions and the worry is we don't have the airflow. So a lot's going to be is, look, if you're going out to dinner, look at what the restaurants are recommending. Some restaurants actually are recommending reservations ahead of time, even if there were walk-ins before. Make sure that if you're going in a group, they'll probably limit groups as they go in. But the precautions that I feel like we need to take is making sure we're doing what we can to protect the people that work at the restaurants, because they're, going back and forth, and they want to make sure they're protecting us, and we want to make sure we're protecting them. And I think keeping it small groups, looking over information on what the restaurant's policies are, making sure you're outdoors, is the key on a lot of this.
Yeah, I thank you for saying that. We do have to keep in mind here, as we are trying to protect our families, the people who are on the front lines, the grocery store workers, the restaurant workers, the hairstylists, the dentists, they are putting themselves in harm's way to provide services to us. And so I've read stories about people being upset because a line was long, or a grocery store didn't have this. And we just, it's not good. It's not good. So I hope that if you are someone who has done that, if you're watching this, don't do that. Think about these people as if they were your own relatives, your children, you out there working. So, all right, I'll get off my soapbox right now.
No, I think everything you're saying is so key and so important. I think, the key words I feel like I keep using are like protecting community and like society. And that's really this is a pandemic. Like, this is affecting every single person in this community worldwide. And, not everyone has the, opportunities to work from home all the time. Yes, like I, as a healthcare worker, I'm there, as a frontline worker, but I'm not the only one. We still need our groceries. We still need to go get our medications from the pharmacies. There's people, we need food delivery. Like, food delivery has been a big thing. Like, there's so many things that are still going on that, we don't realize until you say, like, oh, like, you still have a job. Like, you're still here dealing with people every single day. I need to make sure I'm doing what I can to keep you safe and protect you as they're trying to protect us, and why they're limiting how many people go into stores, why they're asking for universal masking for every individual that goes in. It's for everyone's safety.
Yeah. Thank you. I just, oh gosh, I get so disgusted every time I see stories about people refusing to wear masks. It's like, why? Why is it that hard? So we have another question from Tana Jackson. Hi, Tana. Although we are in phase 1, what will we need to do to move effectively to the next stage? What is the criteria? I'm guessing, before you answer, that's a regional or community type question. But in general, do you have any sort of, I guess, big milestones that you and the medical community look at in terms of when generic community A can move from phase 1 to phase 2?
Yeah, I think it's obviously it's going to be different for every community how things happen. I think the key factors are still going to be the data. The data and the numbers are so important on this. We are just like, many communities in the last week are just going to phase 1. New York still hasn't even gotten to that point yet. I think what we're seeing is we need to make sure that in this phase 1, our numbers don't get worse before anything gets changed. And I think that's where a lot of, like, for me, that's some of the fear that I have is, I obviously want to make sure everyone's safe. We want to make sure people are getting on, moving forward, doing what we can, trying to create some, communication as we, open up places. Businesses need to open up at some point. We can't social distance forever. But, this phase 1 is very crucial to seeing what the numbers are doing, what the curve is doing before the next stages are even discussed. Because, we talk about flattening the curve, and this is sort of where these words come back and become important again.
Okay. Speaking of flattening the curve, we met over a discussion about the flu. I mentioned that at the beginning of this show. But okay, so flu season is not that far away now. So what can we do as we attempt to flatten the curve? How do we keep it there and then also deal with whatever's coming with the flu? Because I remember in our conversation, one important thing that I learned from you is that the flu, we get the vaccine based on what happened the year before. So this year, it was particular when I got it, it was particularly bad because the strain I had wasn't in the vaccine or however they produced it. So what does it all mean when we have the flu, when we have COVID, if we flatten the curve, if we haven't flattened the curve, how can we keep ourselves as safe as possible?
Yeah, so it's a lot so let me try to break it down a little bit because it is a lot of information and it's still, up and coming. So I mean, like, so one of the key words is what is flattening the curve? So flattening the curve, just to sort of go over the basics that we've been talking about. So the curve that we talk about is sort of the escalation or the number of cases that we're seeing in the hospital. So this is more of the protection or sort of how to not overwhelm hospitals. So the curve that we talk about is, how fast are patients coming in? And initially when COVID did come to the US, there was an exponential rise. So we kind of went from, we're seeing 1 or 2 to all of a sudden it went up. And that's the curve that we're like, how do we flatten this? And the flattening is we're going to have numbers, like the numbers that they predicted are maybe there at some high levels, but it's the flattening of the curve, meaning we have a easier way for like not to overwhelm the hospitals and the staff to take care of patients, meaning, initially when we were hearing about it, a lot of communities didn't have the ventilators. We're running out of equipment. We're running out of so soon. We're using more equipment. But if we can flatten that curve and make sure that we're not getting the hundreds of patients in at one time and, sort of trying to limit or lessen how many come at one time, we can safely manage and take care of patients, and the patients can be safely taken care of and have a space, have the things that they need. So flattening the curve has been key as far as how we're even being able to move into next phases. When it comes to the flu, so this is where it gets so tricky and frustrating, I think, for a lot of us, especially as a healthcare worker. COVID happened during flu season. Flu season was happening, and and we're like, oh, do you have the flu or do you have COVID? And this is when we had no idea what we were looking at or managing with COVID. So now we're dealing with patients coming in, or do you have the flu or what do you have? And initially, when we didn't unfortunately have enough testing, we were really struggling on how we were doing it because we had to really limit how we were testing patients at first. And, who knows, if we were missing cases in the beginning or what was happening at that time. Because, that's another, concern that we've been having is how do we safely and are able to test bigger communities. And, so we're, sort of seeing that gamut, or we saw that gamut. And now that, theoretical flu season is over, but still going to come back, I think we have to keep all the precautions that we did for flu season. So, we talked about flu vaccine. So, we have a vaccine for flu. We should try our best to get it if we have the availability and the capacity to do it. We have treatment for flu if we have flu. We have testing for flu. So these are all important things that we need to know. Like, we don't have vaccines for COVID. We don't have direct treatment for COVID, but we're still working on managing on how we can do that.
Okay. Wait, I'm sorry. I just got a request from Antonella, who wanted to see you full screen, and I don't think I actually did that correctly. So we're going to just stay where we are right now.
When it comes to the flu vaccine, I know this is like another, we can have a full hour conversation just on the flu. But as, flu season approaches, coming this fall, vaccines are going to be out. And, what the questions that we always get is, how effective are the flu vaccines? And, the flu vaccines are created based on the data that we have from previous flu seasons. And yes, we try to cover every flu that we, virus that we have, because it's not just one, it's many different viruses that can encompass it. And we try our best, like the researchers that do it, they try their best to encompass what they think might be higher risk. And, with vaccines that we get, we do build some immunity. So even if you did get the flu even though you had the vaccine, the hope is that you are not going to be as sick as you would have been if you didn't get the vaccine.
Okay. So what I got from that is, make sure if you do nothing else, you get your flu vaccine, because I can imagine there might be cases where people have had both at the same time. Is that something you've seen?
So, initially we weren't sure, but there have been case reports of people both having the flu and COVID. And, we're still learning from what does that mean? And, can we get both, or what is it going on? But, at this time, we're not taking anything lightly and treating everything as we can and as it comes in.
Okay. Thank you. That was a personal question I had. All right. I have a question from Loving Goldie. How soon would you recommend going to the malls? And then I got another question on Instagram about phase 2. So I don't know if that's actually, if going to the malls, if that's part of phase 2, but do you know sort of do you have a broad idea of what kinds of things might be happening and what most people are calling phase 2?
I'm not 100% sure, so I don't want to misquote on what, phase 2 is going to look like.
Okay.
Malls, again, and again, it depends on the community. Like certain, warmer areas may have outdoor malls, and I can't speak for, what indoor shops are going to do, because I think the worry that we have is the more time you spend indoors is we don't have the airflow that we have outside, where we feel like there's a little bit more protection or some balance of, how the droplets are being spread. Okay. And I think, again, I haven't heard personally of malls that are reopening and what their policies and rules are looking like for each shop. So it's going to be very community based on where those malls are located, what individual stores are doing as far as, clothing, mask wearing, obviously, how if there's samples, like makeup samples that we want to try, like, Sephora, a lot of these companies, like, they're going to have to really look to see how to safely, treat customers. And I think I personally haven't seen data on what's going to be happening with that right now.
Okay. I think, and I think that's fair. I think there's, like we said earlier, there's so much that we don't know, but I think that what we should all take from this is, common sense goes a really long way. So even if, let's say, makeup samples are out, does it really make sense to use them? When we already know what we know about how it spreads. I mean, I think that we have to, in a lot of this, rely on our own common sense. I remember in the beginning of the season, my mom was like, wear your mask. I was traveling and I was the only person on the plane. This was like at the end of February, the beginning of March. Mm-hmm. And she was like, wear your mask, wear your mask. So of course I wore my mask because I didn't want to hear her mouth, and I sent her a picture. But I remember at that time when, we were hearing don't wear masks. And I know that part of that, of course, was making sure that healthcare workers, on the front line had them. But I think that it just created, this false sense of security where, okay, we don't need masks. And I think of all the situations that I was in, and like, for the grace of God, I wasn't infected, but, I think about all those times when I wasn't wearing a mask, I wasn't social distancing, right, when this was brewing. But certainly now that we know, I think knowledge is power, and we have to use our common sense. We can't wait for other people to tell us what to do, especially in the most vulnerable positions. I'm especially concerned about what I expose my family to, because my dad lives here. He's got chronic bronchitis, and I don't want that. I can't live with that. Like if just because I decide I want to go out here because I've been in the house too long, I couldn't live with bringing something back because I wasn't careful. So anyway, that's a whole other story. But I see here that my live ended on Instagram. So I don't know what happened with that. So if you're watching on Facebook, we're still here. We're going to wrap up though shortly. I have one question. If you have any more questions, feel free to just drop them now. But this one from Michael. Thank you, Michael. If this hasn't been asked, and it hasn't, what's your advice for joint custody parenting scenarios where kids are traveling back and forth between homes?
So that's a really good question. I mean, kids are going to be going back and forth. They have different family environments. And I think it goes back to communication between, both homes is, hey, who's at each other's homes? What are the risk factors that were there? And, and I think taking caution as much as you can is important. If, kids are at home A, and they're exposed to maybe a few other people and, running around doing things. And at home B, if there's someone that's maybe higher risk, how do we manage it? I think, the key is communication. If it's, going from home A to home B is, before you touch anything, you need to shower and change your clothes. That's going to be, a discussion between the kids and the parents and everyone at home to be, how are we minimizing all the exposures that we can bring into any home? So it's, I think, it's communicating, to each other making sure the kids are safe, doing what you can to keep, yourself clean and moving forward from there.
Okay. So Michael, I hope you're still there and you got that question. I've seen that a lot, and I've wondered kind of how people manage, but I would imagine too, there's a lot of trust involved.
Exactly. It's all, I think key is in these scenarios, as we're learning, open communication about, hey, like, this is where I live. These are the people that are in my bubble. The kids are coming over, and people in my bubble are, communicating with X, Y, and Z. So if the kids are going from a bubble A and then now we're going to go to bubble B, who's being exposed in bubble B? And if there's any risk, I think, kids are going to be traveling back and forth, and it's going to be making sure you have that open communication. If the kids are running back and forth, I think it's safe to, talk about what appropriate clean hygiene is. If it's, we talked about disinfectants, if it's, changing clothes as soon as you come in, taking showers, all these are, pieces of advice that, you can gather and communicate with one another on what the best scenario is moving back and forth.
Yeah. I couldn't agree with that more. So it looks like on my end, I don't have any other questions. I think I've asked you all of my questions, although I reserve the right to text you in the middle of the night. Like I've done before. Like,
you're doctor on call.
What do you think I should do about this? But no, I want you to know, Dr. Jain, I really appreciate you coming here. For our viewers, if they do have any additional questions, are you open to sharing your knowledge with them?
Yeah, I mean, absolutely. I mean, thank you again so much for having me on this. I mean, I think we've repeated ourselves multiple times. I think, I hope my goal obviously was to make sure that, whatever fear people have, because there is a lot of misinformation, there's a lot of anxiety moving forward. And I want to at least help be some sort of voice and some sort of platform to help eliminate some fear and some anxiety so people can stay safe and stay educated on what's important and what's going on out there. Because like you, I'm learning a lot as things move forward too. And, this is a very interesting and powerful time that we're living in. And everyone as a community should be doing it, the best that we can to help one another out.
Awesome. I'm putting in your Instagram. Is it AABHS?
S1. Yep.
1. All right. So I'm putting this on here just in case you guys want to follow Dr. Jain, see what she's up to. She's just been such a great resource. Again, thank you so much.
Thank you so much for having me.
You're welcome. This was fun. Thank you for being our inaugural guest on Live with Richie. For those of you who enjoyed this, I hope that you will come back. I hope that you will, subscribe to The Rich Life on YouTube. Definitely. I would love to see you there. You can follow me on Instagram at All Things Richie. And you can also check me out on Facebook and LinkedIn at Richie Holmes Grant. LinkedIn didn't work tonight, so we got to go back and fix that. I don't know what happened, but I'm going to call my tech friend and see if he can help me out. But thank you guys again. Please, everyone out there, stay safe, whether you are going to the salon or to the dentist or peacefully protesting. Remember your social distancing. Remember to wear your mask, and remember to take care of each other. All right. Until next time, take care, everybody.
Bye.
Bye.